side effects with this, but chemotherapy is a treatment of cancer with one or more cytotoxic drugs. Studied further during World War II at Yale University, it was reasoned that an agent could kill rapidly growing white blood cells in a body. And my brother actually had Hodgkin's lymphoma, a type of cancer where white blood cells are affected. And he had chemotherapy, and it helped him a lot. During 1942 in December, 7 patients checked in to Yale, and they saw a remarkable change when given chemotherapy, but they did not survive. Chemotherapy is given by the vein, and it is dripped. It is a bag of liquid, and it is dripped into the veins, and then is dispersed throughout the body to fight cancer cells. This also worked very well for my brother, but the side effects are you lose your hair. My brother lost her hair. This woman has no hair. And every time after chemotherapy, my brother would throw up, which is a side effect of having chemotherapy. And you also get aches and pains and chills throughout your body. It's a very, very effective process, but it all matters on the dosage. If you have the least, less amount of dosage, it may not be effective in people, and if you have more, you can have the harsher side effects. Last, we have radiation therapy. As you can clearly see, the man is laying down and radiation is being sent through his body. Radiation therapy has been around for more than 100 years, dating back to 1895, from a Nobel Prize winner discovered it. It is painless, unlike chemotherapy. The only side effect that will happen in the patient is where they are being treated, and it is one of the least harmful, and it is better for you, I guess. You're still putting harmful chemicals into your body, but it'll still treat your cancer cells. And the side effects, they're limited and predictable. The doctors do know where in this patient where he's going to have the most amount of trouble in his body and where it's going to affect him the most. So we have 3 types, and it all really depends on what type of cancer you have. Clearly we can tell this woman here that she's a breast cancer survivor, as you can see, and then surgery and chemotherapy helped her in her recovery process. It is the recovery process for cancer and chemo, radiation, and surgery is very long and can be painful to some patients. And depending on what type of cancer you have, the survival rate may not be very high. So, but all in all, if you do have cancer, there is hope. You do have a chance to survive. Clearly, you can see that these people are getting better and they are getting treated, and that radiation, chemo, and surgery are the best way to go when you do have cancer and you are diagnosed.